Endometriosis. It's one of the most common yet misunderstood conditions affecting women, impacting an estimated 1 in 10 women of reproductive age. But here's the problem. Despite how common it is, many go years without a proper diagnosis, living with pain they've been told is normal. In today's video, we'll break down what exactly is endometriosis, the possible causes, the symptoms you shouldn't ignore, and the treatments and lifestyle tips that can help. What is endometriosis? Endometriosis happens when tissue similar, but not identical, to the endometrium, the lining inside your uterus, grows outside of it. This misplaced tissue can attach to organs like your ovaries, fallopian tubes, bladder, intestines, and even in rare cases, beyond the pelvic area. The problem? This tissue responds to hormonal changes during your cycle, just like the uterus lining does. It thickens, breaks down, and bleeds. But unlike your period, it has nowhere to exit. This can cause inflammation, cysts, adhesions, and severe pain. Doctors still can't pinpoint one exact cause, but several theories exist. Retrograde menstruation. Menstrual blood flows backward through the fallopian tubes into the pelvic cavity. Genetics. If your mother or sister has endometriosis, you're more likely to develop it. Immune system dysfunction. The immune system may fail to recognize and destroy misplaced endometrial-like tissue. Cell transformation. Some cells outside the uterus might change into endometrial-like cells due to hormonal or immune factors. Surgical scars. Surgeries like C-sections may accidentally cause cells to implant elsewhere. Endometriosis symptoms vary. Some have mild discomfort. Others experience life-altering pain. Common signs include painful periods, dysmenorrhea. Cramps may begin days before menstruation and last beyond it. Chronic pelvic pain, persistent ache, not just during your period. Pain during or after sex, especially with deep penetration. Pain during urination or bowel movements, particularly during menstruation. Heavy menstrual bleeding or bleeding between periods. Infertility, endometriosis, can be found in up to 40% of women with infertility issues. Bloating and fatigue, sometimes called endobelly. One of the most frustrating things? These symptoms can overlap with other conditions like IBS or ovarian cysts, which is why diagnosis can take so long. Unfortunately, there's no simple blood test for endometriosis. Diagnosis often involves detailed medical history and symptom tracking, pelvic exams, imaging such as ultrasounds or MRIs to look for cysts, laparoscopy, a minor surgical procedure that allows doctors to see and sometimes remove endometrial-like tissue. On average, it can take 7 to 10 years for a woman to receive a diagnosis, which is why awareness is critical. Treatment options for pain management are over-the-counter painkillers like ibuprofen, prescription medications for severe pain. Treatment options for hormonal therapies are birth control pills, patches, or rings, GnRH agonists and antagonists to suppress ovulation. Surgery options are laparoscopic excision or ablation to remove lesions. In severe cases, hysterectomy, though this is often a last resort. Lifestyle changes for prevention. Anti-inflammatory diets rich in leafy greens, omega-3s, and whole foods. Regular exercise to improve blood flow and reduce inflammation. Stress management, yoga, meditation, or counseling. Treatment is highly personal. What works for one woman might not work for another. Living with endometriosis often means managing both physical and emotional challenges. Support groups, both in person and online, can make a huge difference. Journaling symptoms can help you and your doctor track patterns. And remember, pain is never something you just have to live with. Advocating for yourself is key. Endometriosis is common, real, and not just bad periods. If you suspect you have it, talk to a healthcare provider who takes your concerns seriously. The earlier you start managing it, the better your quality of life can be. And to those already living with it, your experience is valid and you are not alone.